We are sticking with the theme of pain today. I am now joined by Dr. Konstantin Tsymbalov, interventional pain management specialist, also with Orthopaedic Associates. Welcome to you and thanks for being here. So what is a pain specialist?
Pain specialist will be a physician who focuses in his practice to help patients to get rid of pain, to help them to tolerate pain, and all with non-surgical procedures.
Non-surgical. So what types of problems do you normally see?
We usually see most of it will be neck pain, back pain, but also it could be headaches, could be pelvic pain, extremity pain, you know, arms and legs and, you know, feet and hands.
Okay. And then in terms of the treatment, if you are starting with non-surgical, you know, types of treatments, what are those?
The first line treatment will be lifestyle changes. Then it could be physical therapy. Then we can go to some of the medications, non-steroid medications, such as ibuprofen. It's very simple, but sometimes it helps a lot in the different modalities of those. It could be a patch, it could be some ointment, it could be just a pill. And then we can go to different interventional some injections, starting with the trigger point injections and different injections under the serum.
And one of the things that you do, of course, and this is, I'm assuming, pretty standard, when somebody comes to you with this pain, you individualize their treatment plan. So what may be for one person may not be, you know, what you're recommending for somebody else. All right, so I'm coming to you, my doctor's already given me medication. What's next, or how do you evaluate after that?
Thank you. That's a very good question. So first, I want to talk to you and see what you want to tell me and what is your complaint, so I can get an idea where we're going. And then I'll ask you particular questions, and then I do my very thorough assessment, and that includes clinical exam when I try to figure out which part of the body is actually the problem for the pain. Okay. And only after that we'll try to correlate all those complaints and all those physical finds with imaging, which could be X-rays, it could be CT scans or MRIs.
Okay, and you may have mentioned this before, the most common types of pain complaints that come into you, what you said, neck and...
Yeah, neck and low back, that's the most common things.
And something that you know, I'm curious, do you see all ages, like teenagers, athletes, you know, or is it just the more mature person?
Yes. Actually, any age could be vulnerable for that, but mostly yes, because age is one of those predisposing factors. So yes, you know, with aging, our arthritis is more progressed, and we have more pain and problems with the musculoskeletal system, yes.
So
definitely.
now, do you do procedures? I mean, are there some types of procedures that you actually do?
Yes. In the office, we do procedures simple as the trigger point injections, but they work really well, and some patients that don't require anything else. And then on the C-arm in the operation room, we do different injections, such as epidural, but there could be different types of those. It could be nerve blocks, it could be facet injections, or it could be even ablation, which is called radiofrequency ablation, when we ablate the nerve and stop the pain from the back. And also up to spinal cord stimulators. However, that is a little different topic.
Okay, all right, and if somebody's having complaints from any of those regions, they can call you, 883-4707. I'm going to say this once again, just because I think I've gotten it. Dr. Konstantin Tsymbalov. A pleasure to talk with you today. Thank you so much.
My pleasure.
And stay with us, everybody. Coming up later on WALB, Americans are buying bigger, pricier homes. How much larger are they buying? We've got that ahead at 5. In the meantime, for the latest news and weather, log on to WALB.com. You can also check us out on Facebook and Twitter.